Well, thanks for joining us for KIMT News 3 at 6. I'm Katie Lang.
And I'm George Mallet. First tonight, Minnesotans exposed to coronavirus may now be able to spend less time in quarantine.
The state's top health experts are updating their quarantine guidelines.
KIMT News 3's Anthony Monzon joins us live with the details. Anthony?
Katie, George, the adjusted guidance from the Minnesota Department of Health means you could be spending less time in quarantine if you come in contact with COVID-19. Now, this comes on the heels of new data from the CDC showing quarantine periods could be shortened under certain circumstances. So under this new guidance, Minnesotans will be able to end their quarantine 10 days after being exposed if they have no symptoms and have not tested positive for COVID-19, or 7 days with no symptoms and a negative test result. Now, experts still maintain a 14-day quarantine is the best way to reduce the spread of coronavirus, but officials are hoping by trimming off the last few days when the risk of transmission becomes significantly lower, people will be more likely to comply with guidance.
The science has not changed around this. We're changing some of this for social compliance reasons.
Now, one notable caveat to these new regulations is that MDH is still asking healthcare workers to quarantine for the full 14 days. I also touched base with Olmsted County Public Health earlier today, and they told me this in part. They say the new guidelines will add some complexity, yet we support this broader vision. The safest option is to quarantine for 14 days. However, the new guidelines continue to protect the most vulnerable areas of our community while allowing more flexibility for other areas that are lower risk. Live in Rochester, Anthony Monzon, KIMT News 3.
Thank you, Anthony. You mentioned Olmsted County Public Health. They're also saying they're reviewing the new guidance and updating systems and processes, which may take a few days to complete.